Hello students, in this session we will talk about art therapy in more detail. In earlier session we just emphasized that expressive art therapy is a multimodal approach and art therapy is one of its kind, and people have been relying on the arts for communication, self-expression and healing for thousands of years. But art therapy didn't start to become a formal program since 1940s. With the inception of the Art Therapy Association of India, which was established in 2019, it's now has been established as a profession, and since 2 decades we have bent among the people to practice this art therapy, and the association which has been established for promoting this therapy is now working for developing the ethical guidelines and the practice of art therapy in detail. In part 1, we will discuss about art therapy, its nature, types and techniques. We all know that child is very playful and it's very artistic. The child always tries to explain or oneself or the create something new. But the child, when he grows and becomes an adolescent or an adult, it does not mean that a child is no more there in our own self. The child remains within us. Every child is an artist. The problem is staying an artist when you grow up. So, when you grow up, you just forget to become a child, to express your own self and learn to hide your emotions. And if we just remain connected with our childlike attitudes to express our creative potential, we can have the benefit of our own self expression, because art washes away from the soul the dust of everyday life. All of us experience many stresses, many anxieties and many problems. These quotations are of Pablo Picasso can explain what I want to convey, that always remain connected with the child of your own self, because if you remain connected with your child of your inner self, you can wash away all the complexities or the stresses of your life, the dust of your life. So, if the child remains alive in our inner psyche, the person feels that he is important, he is or she is being understood, because the person is given opportunity to express the creativity which is very important in the process of our own healing. Art can help people to connect with our own self and handle our intimate and ordinary dilemmas, intimate and ordinary experience that we don't want to share with our friends or the relatives. We sometimes feel that what can I do about the difficulties in my relationships? Why is my work not satisfying to me? Why do other people seem to have a more glamorous life than me? So these are all causes of being unhappy in our life. So if we want to be happy in our life, because happiness is the ultimate goal of our own life. We all are here in this earth to experience happiness, pleasure in our own life. Nobody wants to be sad. So, if we remain connected with our creative potential and the child within us remains alive, then we feel happy in our own life. So, art is a very wide term. The definition of art is divided from various philosophies and psychology. Three different definitions in the art are mimesis, formalism and expression. Mimesis, here is a picture of Mona Lisa, everybody might have seen it, and it can be explained by people differently. If the person is giving an opportunity to replicate or to redraw this picture, they perceive it differently. This is an example that how sketching or drawing can represent the inner world of a person. Formalism deals with the shapes, colors and patterns. The handwriting analysis philosophy is based on formalism, and this technique of handwriting analysis can depict the thinking pattern, multiple intelligences, cognitions and emotions of a person, and help the therapist or the counselor to connect with the subconscious mind, which is the potential of our creativities and it is connected with the art analysis. So, making the art is another thing, but analysis of art is done by the experts, by the psychologists or the psychoanalysts, because by analysis of the artistic production we can remain connected with the subconscious mind of the person, and which is not even accessible to the person himself or herself. Expression is the color, design, shapes, each of which has personality. If the person is given free hand to analyze, to express one art through different drawings, we can have an access to the person's personality, the blind spots in the personality, and what is repressed within the psyche. So, what is art therapy? The use of artistic methods to treat psychological disorders and enhance mental health is known as art therapy. Art therapy is a technique which is rooted in the idea that creative expression can foster healing and mental well-being. And there are many studies done by doctors which reveal that individuals living with mental illness often express themselves in drawings. The mental patients, if they are given situation, they just draw something, they just do some artworks which depicts their inner expression of the self. So, it can be used as a healing strategy, as a therapeutic method for the person's own well-being. And when the person draws something, we get inspiration, and we get a feeling of control over our own situation. So, art therapy is a discipline, total discipline, and in which we have different main ways in which it can be analyzed. There are huge amount of theoretical perspectives which is connect, which in earlier lecture I discussed many things, but here I would like to mention the psychoanalysis, the analytic art therapy, which talks about the projective techniques which are used for the understanding the subconscious mind and the personality of the person. You might have heard about the techniques of thematic art perception, TAT test, Rorschach test, sentence completion test. So, these are the projective techniques which are actually not artistic. In Rorschach test, it's a picture, a drawing which has been already made is shown to the person, and is sort of ink blot, then the person is asked to explain what he or she can see. So, what the perception of the person is analyzed, or the person, the written expression or the picture made by the person can be analyzed to reach the subconscious mind, and art can be used as a psychotherapy. The outlook of the client while explaining the artwork can be used by the psychotherapist to understand the mind of the client, because usually when the client draws something, he verbalizes something. You say sometimes the children who draw something, they say this the father, this the mother, they are doing this, they are feeling like that. So, the verbalization which is made during the artwork can be used as a psychotherapeutic technique. Art therapy is looked at is though the lens of the art is therapy. Some art therapists practicing art as therapy believe that analyzing the client's artwork verbally is not essential. Therefore, they stress the creative process of the arts instead. It's not that you show the picture or you just take the verbalization into consideration. You can encourage, the art therapist encourage the person to create something, to indulge the client in the creative process of generating certain artistic outcomes. In all these approaches of art therapy, the art therapist clients utilizes paint, paper and pen, clay, sand or fabric or other media to understand the emotions of the person. So, there are many creative therapies. Art therapy is one of them, like dance therapy, drama therapy, expressive art therapy, music therapy or writing therapy. And the goal of these art therapy is to utilize the creative process to help the people explore self-expression, and in doing so find new ways to gain personal insight and develop new coping skills. The creation or appreciation of art is used to help people explore their emotions, develop self-awareness, cope with the stress, boost self-esteem and work on social skills. As clients create art, they may analyze what they have made and how it makes them feel. Through exploring their art, people can look for themes and conflicts that may be affecting their thoughts, emotions and behaviors. If we give many opportunities or many sessions to the client to create an art, there can be recurrent themes. Some people may like to draw the picture of specific animals, or they may like to draw the picture of nature, or they may like to draw certain written material or anything they may like. So, if there is any recurring themes which are occurring in the subsequent artistic work, it can be helpful for understanding the thoughts, emotions and behaviors of the person. And the techniques which are used in this art therapy are collage, coloring, doodling and scribbling, drawing, finger painting, painting, photography, sculpting, working with clay. In collage, the person is given an opportunity to make a collage out of a different piece of paper, different pictures, photos can be used, and certain instructions can be given to make a collage. And in doodling, the person is also making small artwork without any purpose. So, this small doodling activity can help the person to reconnect with his own goals of life, or to understand one's own emotion. And it is usually done when the person is totally engaged or absorbed in a situation. Sometimes we feel that we just draw certain things without having any idea in our own mind. So, doodling can be helpful in distracting our mind from negative thoughts. Scribbling, drawing lines without putting the pen from the paper can be helpful. Putting colors, adding colors to the picture is a technique. Photography is a technique. Sometimes we find that certain thing is very cool and very interesting, we just want to capture that event. So, photography can be expressive technique. Sculpting, with the use of a clay or some material, we can draw idol or of our choice, we can make self portrait. So, it can be another technique. Mandala is a very old technique which is based on Carl Jung's theory, and it is a psychological expression of the totality of the self, and the patients who are socially neglected or unsocial or lonely in life can be administered with mandala therapy. And mandala therapy is the way of life for people who do not receive support from fellow human beings. It is the person is instructed to draw a bigger circle and go inside, and certain lines can be put crossing each other, and there are no specific instructions for making the mandala art, but it can be told to the person that whatever he likes, he can start with a bigger circle and go inwards. And it is believed that by mandala art, the person can be helped to align the chakras of the body. These chakras are the energy wheels in our body, and if the mandala art is practiced, it has been seen that all the chakras in our body becomes aligned. There are techniques to capture the energy in each chakras of our body. Killian photography is a technique through which there are certain cameras which are used to tap the energy level of different chakras in your body. So, it has been found that the chakras become aligned when we use mandala art. Bird's nest technique is another way to assess the attachment security within the child, and there are many researchers who reveal the children who are securely attached in their childhood are more happy and healthier, and they are better able to make social relationships. And if the person can be given a material to build a nest and the miniature bird or the eggs to show it. So, Kaplan and Main in 1986 and study of Lieberman, Weston and Paul investigated therapeutic investigation to alter the attachment patterns of the insecure mothers and their infants. So, if there are problem or issues with the relationships within the person, we can search this attachment security at childhood and try to heal the person from the memories, painful memories which the person is suffering from, and get rid from those complexes which are debilitating the capacity of a person to form healthy relationships. Part 2 of the session is connected with benefits of art therapy, and there are many benefits you can see here. Different issues, aging related, stress, anxiety, cancer patient, depression, eating disorder, emotional difficulties, relationship issues, medical conditions and psychological symptoms associated with medical issues, PTSD, psychosocial issues, physical violence, domestic violence, substance abuse, disorders. So they can all be healed with the art therapy. And in this process of art therapy, what happens, the creative expression opportunity is given, and it leads to self awareness, and then insight and the positive change occurs within the person, and then result the healing and the person's increased level of well-being. So there are benefits of art therapy. According to 2016 study published in the Journal of the American Art Therapy Association, less than an hour of a creative activity can reduce your stress and have a positive effect on your mental health regardless of artistic experience, age and talent. Where it can be used with adults, children, the person suffering from traumatic events, person with learning disability, people with brain injury, mental health problems, and there are many findings on the effectiveness of art therapy, although these findings are mixed and studies are often small and inconclusive. So, further research is needed to explore how and when art therapy may be most beneficial. But the studies reveal its positive impact for the trauma survivors, the cancer patients, the depression patients, and now we can think that there are certain things which have to be considered for art therapy. If you or someone you love is thinking about art therapy, there are some common misconceptions that facts that you should know. You don't have to be artistic. People may think that I'm not good at art, I cannot become an art therapist. If you are open minded person, if you have the ability to learn more and more, you can develop your skills to be an art therapy. Only thing is that you have to be empathetic and open minded to accept people as they are. In 2017 study found, it was found that art displayed in hospital settings contributed to an environment where patients felt safe. It also played a role in improving socialization and maintaining an identity outside of the hospital. It is not the same as an art class. People often wonder how an art therapy session differs from an art class. So, where an art class is focused on teaching technique, the art therapy is related with exploring the inner world of the person and the inner experiences and how the person relates with the outer world. So, it is not the same as art class, because in art class the teacher gives instructions how to draw better and how to become a good artwork. So, art therapy can take place in a variety of settings, in offices, schools, hospitals and community organizations, and it is can be used in art studios, in colleges, universities, community centers, correctional facilities are there, group homes, homeless shelters, private therapy offices, residential treatment centers, senior centers, wellness centers and women's centers. There are many settings where it can be used. The only thing which is needed is a good art therapist to help the clients to grow up. And you have to remember that art therapy is not for everyone, because some people are very resistant and they are not suitable for art therapy. And if we want to start art therapy, we have to seek out a trained professional, because they are have credentials from board website. They can have a better qualification to be art therapist, and it may not be that you might be get your insurance for art therapist, but if this therapist is certified, then you can get some benefits. And you can ask about specialty of the client, because depending you have to take the case study of the person, then you may start the art therapy, because some people might be having trauma related issues, some may have substance use disorders, some may have anxiety depression issues. So, first you have to ask their specialty in which they are good at and choose the technique which is suitable for a particular person and what can work in that particular situation. So, both have to work together, the client and the therapist both can work together to find the expression of the inner world of the person. And you should know what to expect. You should not expect that there should be a very good artwork. Only you have to focus on the process what the person is making, and you have to be prepared to answer the questions about your own art making process. The client may ask, are you good at art making? So, you can share your own experiences, because it can have developed the feeling of competency, control and self confidence and being accepted by the therapist during the art making process. So, if you want an art therapist, there are certain associations which are working in American Art Therapy Associations. It needs a master's degree in art therapy, or you can have a master's degree in counseling or a related field with additional coursework, because art therapy needs a person who is capable of counseling also, because the purpose is to heal the inner wounds or the problems of the person. So, you have to develop the counseling skills also. And in India, we have certain institutes which give the art therapist diploma. Indian Council for Professional Education Mission, registered under Niti Aayog, Government of India, Karnataka, offers diploma in art therapy, for which master's degree in psychology and allied subject is required, and you can search on the website of this mission and get registered for becoming an art therapy. The Art Therapy Association of India, established in 2019, is here to promote art therapy as a valuable and regulated profession within the mental health ecosystem of India, contributing to individual, community and social well-being. This institute aims to become the collective voice of the profession in India and strives to represent the interests of the profession of art therapy in India in multiple flora within educational academic systems, mental health ecosystems, professional circles, government bodies with NGOs, international platforms, media communities and other public platforms to advocate for the field of art therapy in India. The association would help formulate guidelines for academic standards and accredit professionally recognized training for art therapy. These are the references which you can refer for some good articles on art therapy, and these are the journals, names and the author's name and the year. The study is done by the Butcher, Susan Bulcher, Ball B. Dale books, and if you want to learn more, you can refer these references, and thank you very much for patient listening.